I'm Melissa Ishmael, and the title of my project is Starving Stomachs Lead to Sad Smiles. So what I'm going to be talking about is how eating disorders can affect your oral health. So I'm going to start off by telling you what is an eating disorder, and it is a psychological disorder characterized by abnormal or disturbed eating habits. The three most common eating disorders that we think of are anorexia nervosa, bulimia nervosa, and binge eating. Anorexia nervosa is when someone does an extreme limit of the amount of food that they intake. They often have a distorted body image, and they often fear that they are going to gain weight. So here I have a picture of a very thin lady looking in the mirror, and she sees a large lady when she looks in the mirror, but she obviously has a distorted body image because she's very thin. Bulimia nervosa is when someone will compulsively eat a large amount of food, and then they will purge the food. So they will either vomit, take laxatives, or do extreme exercise to get rid of the food. And over here I have a lady, she is eating a lot of pizza, but she's right next to the toilet because she's ready to purge as soon as she's done eating. Binge eating disorder is when a person goes through periods of compulsive eating, and then they're often feeling guilty or depressed afterwards, but they don't purge. So who is likely to develop an eating disorder? Often it's found in young females, ages 15 to 25, but really anyone can get an eating disorder. It's just more common in young females. This is probably due to, peer pressure to be thin. Maybe their parent has weight issues, or maybe, they're seeing advertisements and on social media of really thin ladies and they want to be like that. Some traits that can cause a person to develop an eating disorder could be, the fear of gaining weight, distorted body self-image, impulsivity, anxiety, depression, or other mental or intellectual disorders. So how do you treat an eating disorder? Well, you would need a combination of things. You would need pharmacotherapy, which would be like antidepressant or anti-anxiety medication. You would also need psychotherapy, so a counselor or a therapist to help you get to the root of the problem, figure out why you're binge eating in the first place. And then you would also need nutrition therapy. So a registered dietitian, can provide in-depth nutrition counseling and help them get back on track eating correctly. So what does all this have to do with the dental profession? Well, oftentimes someone with eating disorders, they want to hide it, they're ashamed, their friends and family don't even know. But when they go to the dentist or dental hygienist can tell that they have an eating disorder based on different symptoms in the mouth. So, some different oral implications of eating disorders. So the first one is called perimyellolysis. So what this is it's a chemical erosion of the enamel of the teeth. And this is caused by the stomach acids that come up when the food is regurgitated. So this erosion can lead to many problems. Of course, it's going to make your teeth look more translucent or glass-like. And the first teeth that you're going to see this in is going to be, the top teeth, the surfaces closest to the tongue, because the acid actually kind of lingers on the tongue for a while. So as your tongue is touching those surfaces of the teeth, the acid is causing erosion. And so here I have a picture of that. You can see right here all these surfaces are eroded. Same right here. And then eventually, these are the first teeth affected, but then they will spread to all the other teeth if the vomiting continues. And so if someone has, fillings or restorations, the erosion will wear away around the restoration and kind of cause pits around the margins of the restoration, and the restoration will appear raised. So another oral implication would be hypersensitivity. and this goes along with the erosion. The erosion kind of takes off that top layer of enamel, which is protecting your teeth, and it exposes the dentin underneath, and that allows great sensitivity. Dental caries are also very common for the same reasons. The acid lowers the pH in the mouth, and that's what causes dental caries or cavities. Something else with dental caries, someone who is binge eating, they're probably not going to be binging vegetables. They're not going to be, eating all the carrots and celery. They're going to be eating cookies, cakes, drinking sodas, and all of those foods are very cariogenic, meaning that they will cause cavities. Something else you will see in someone who purges is an enlarged parotid gland. So this will give the appearance of chipmunk cheeks, so their cheeks might be a little more puffy due to that enlarged parotid gland. Something else that goes along with eating disorders is a lot of stress, anxiety, and this will cause someone to clench and grind their teeth. Bruxism is what that's called. And so the edges of their teeth will look worn down from all the grinding that they do. So the saliva in your mouth plays an important role. It kind of lubricates the teeth. It provides like a protection against acids. And if someone, is anorexic and they're not eating or drinking a lot, their saliva is going to decrease, giving them dry mouth or xerostomia. Same thing with someone who is purging. They're going to also have a decrease in saliva due to all the acidity. So the xerostomia will cause them to have bad breath, and it increases their chances to get cavities. So when someone is not eating, or if they're purging all of their food, their body's not absorbing all the nutrients that it should. And nutrient deficiencies can cause several different problems in the mouth. One of the main ones is angular cheilitis, and this is just, red cracking in the corners of the mouth. And also a red burning tongue, really a burning sensation all in the mouth. It also can cause pharyngeal burning and swelling. And something else you'll see with patients with eating disorders, especially bulimia, is going to be trauma. So the soft palate, if they are inducing their vomit, they're either using their fingers or toothbrush, they're using some sort of tool to gag themselves. So you're going to see bruises or tears in the palate. And if someone is using their fingers, you're going to see Russell's sign is what it's called. So this is going to be bruising or calluses on the knuckles from where it's hitting their teeth whenever they're inducing the vomit. So how can dental professionals help? So whenever a dental professional sees someone with any of these signs, it is our job to kind of help them protect their teeth. So you want to suggest different things. If someone is binging, you could provide them with a list of foods that are a little bit healthier, that aren't going to cause as many caries. If they have any kind of eating disorder, you of course want to give them proper oral hygiene instructions. So that way they're keeping their mouths clean, and that's reducing their risk of caries and just helping overall help keep their teeth clean. Someone who is vomiting a lot, you want to tell them don't brush your teeth immediately afterwards, because the stomach acid immediately starts demineralizing the enamel on the teeth. So, if they do vomit, they don't need to be brushing, because brushing could brush away the enamel, or it could brush the acid deeper into the teeth. For someone who's vomiting, they want to neutralize the acid before they try to brush or anything like that. So you could suggest a sodium bicarbonate rinse. And what that is, it's basically like a baking soda water mixture. Swish that around, and that will help stabilize the acidity in the mouth. Fluoride varnish and fluoride mouth rinses are also very important. Fluoride helps remineralize the enamel and helps protect against cavities. And those people that have xerostomia, the dry mouth, you want to suggest sugar-free mints or gum to help stimulate the saliva. And for someone who is vomiting, you could make a mouth guard to put on their teeth when they do vomit. This will help protect some from the acid. It'll also help those who are clenching and grinding their teeth. So in conclusion, eating disorders are detrimental to our oral health. And dental professionals often see this first before anyone else because of all of the symptoms that occur with the eating disorders.